Next, we try to look for the other organism called as Candida albicans. This organism is a yeast-like fungi. It can produce asexual spores called as chlamydospores. Here I want you to understand, though the word is chlamydospore, it is not found in chlamydia, it is found in Candida. Also, this organism can reproduce by budding, where the budding may not detach, because of which it can become a pseudo-hyphae for the organism. There is a new cropping up variant of Candida which is called as Candida auris. They have asked multiple questions on Candida auris. This right now here in 2019 in the beginning of your JIPMER exams and PGI exams. Both the exams asked questions in Candida auris. This is the newly gaining fame because of multi-drug resistance. And why is it referred to as Candida auris? Because it is discovered deep in the eustachian tube or in the ear canal of a 70-year-old Japanese male. That is why it is called as auris. Okay, it has created biologically altered metabolic pathway and phenotype change has happened because of mutation in the genotypes. Mitochondrial gene analysis has been done for the organism, and they have tried to use all the types of azoles. The azoles have failed. So they have right now shown some minimal amount of effect using caspofungin drugs or anidulafungin drugs. Even amphotericin B is a failure. Amphotericin B has failed against this organism, Candida auris. Okay, what else have you to know about Candida albicans? You can test for the organism by growing them or incubating them at 21 degrees Celsius in corn meal agar. It throws out chlamydospores. If you try to incubate the organism at 37 degrees Celsius using human serum, then the organism starts producing germ tubes. The germ tube formation by Candida in 37 degrees Celsius in human serum is referred to as Reynolds-Brode phenomenon. What can Candida cause? Candida can attack both immunocompetent people and immunosuppressed people. Why am I telling you that? Think about one thing. Candida can be natively found. It can be natively isolated from sputum, saliva, urine and stools. It means the organism is casually found in the oral cavity, anal canal and genitourinary tract. So finding these organisms in all these specimens is not a big deal, but finding this organism in CSF or blood is a huge no-no. It is dangerous. Why? Because CSF and blood are off limits for Candida. If you find Candida in these specimen, it can only mean there is total internal failure of CMI. Only then you can see the organisms in these areas. So that would bring us to the condition that if a patient is immunocompetent, finding the organism in the oral cavity is not a big deal. So it can easily cause oral thrush. It can also cause vaginal thrush. It can also cause diaper rash by causing diarrhea in the local people. All these are very commonly found in Candida. For example, somebody opens his tongue and he can see flakes white colored flakes of Candida, do not jump into a conclusion that the patient is having AIDS. He can even have it by mild stress or local change in the commensal architecture. If it is immunosuppressed, the organism has a unique way of dealing with it. It can cause disseminated candidiasis. It can cause disseminated candidiasis. Also, it can cause esophagitis. This is called as esophageal candidiasis or candidal esophagitis, which can be very painful form of esophagitis. It can cause odynophagia. Where else will you find painful esophagitis? In case of herpetic esophagitis and in case of drug-induced esophagitis. These are the three conditions where you will be facing painful esophagitis in the history. Now, if a person is having esophagitis and if you have shown that the esophagus contains Candida, then there is a very clear indication the patient is immunosuppressed. The most common chance can be he is having AIDS. So, this is one of the indirect ways of making a diagnosis. Okay.